in the system, which is designed around process and not people. Just get them in and get them out, and do your best and move on to the next one. You're considered a case number, you're considered a disease, you're not considered a person anymore. I put on that blue hospital gown and honestly, my world changed. It is astonishing how fast that happens. I once went for an MRI and I was in the waiting room and the technician came out and said, "Brain tumor," and I was amazed, and it wasn't because of privacy. I mean, I didn't do anything wrong to get a brain tumor. I understand that. My name is pretty simple, 3 syllables, Judith John, and it's the same as brain tumor. But it was so impersonal. You know, it was, there's nobody there yet. There's nobody here anymore but the body and the disease, and isn't this cool? We're going to try to solve that problem. So I started becoming a healthcare advocate, and they started looking at me a little bit differently as someone who'd had radiation and could talk about the patient perspective. And this is not magic. This is basically good communications around good inspiration. I think one of the strangest things, and it's related to this conference, is the unbelievable power of technology. And I went in to someone who was checking my brain scans, and I literally sat at his desk like this, and he was sitting at his desk right next to me, and he was looking at the screen. And I think I must do beautiful MRIs because he was mesmerized by the screen, and he never once glanced at me. And I finally said, "Don't you want to see the packaging at least?" It was such a strange out-of-body experience to just sit there. And he said, "Well, what can I do? I have to look at the screen." I said, "Well, maybe you say to me, do you want to look at this with me and I can explain what I'm seeing? Maybe you take an iPad and sit next to me and show me what's going on. Maybe you just move your head from the screen every once in a while, because that is communications, and that is what people want." They certainly know and want you to have all the knowledge in the world. They want you to use the best of technology, but they want you to have compassion for what they're going through. Every interaction counts. And I'm not saying you have to be Pollyanna at everybody, and patients also have to build a relationship so that we understand you've had a bad day. You have the hardest jobs in the world. You have the job of telling someone this didn't work. You have the job of dealing with families who are demanding things that are unreasonable. You have to deal with the blame that comes. And I have learned in talking to patients about how they can be better patients that we too have to put ourselves in your shoes, in the white jacket. This is all a journey. And I think we as patients can give back to you, and goodness knows what you give us is life and the chance for life and the chance to enjoy life. And I am so grateful for that, and I take every day not lightly because of what you've been given. Go back to the humanity and the reason that you got into healthcare and think about it from the perspective of those you're helping. All your technology will be great, all your newest tools will be amazing, but they won't be amazing unless with the knowledge that you have and the experience you have, with the technology that will enable you to do more and better and faster and wider, that you don't have that human element, that absolute compassion that will help you bond with and help heal your patients.